gentlemen, this has been a great discussion. We've reviewed it and discussed a lot of the information on the latest in treatment of multiple myeloma. To close, I'd like to get final thoughts from each of the panelists, and just to give us, if you think we've missed something or if you want to leave the audience with the take-home message. So we'll start with Dr. Chari.
I think what I'm most excited about is the monoclonals, because I think the two groups that really need more attention are the elderly and the high-risk patients, and I think that's going to be a great place for these drugs, particularly even in the front line for those populations. But I think it's a really exciting place. It's great to have choices.
Dr. Lonial.
Yeah, I mean, I think the confusion you heard amongst us about how to choose is an issue, because we've got all these tools now, and we just have to figure out what the right patient population for using them to maximize the benefit we give to our patients.
All right, the Governor of Massachusetts.
No, I think it's been an amazing year, Keith. And it's worth sharing with our audience that in 2015 there have been 7 approvals in myeloma across all the drugs we talked about. And I think that the remarkable thing is to have 3 approvals within the last essentially 4 weeks to 5 weeks is unprecedented. And I think it's an incredible
Probably
time.
unprecedented in any oncology indication, I would think.
I think it may be. And I think to that point, the integration of these treatments and the sequencing of them are all relevant. But at the end of the day, thank God, we need these treatments. We're not curing anyone. And at the end of the day, if we're going to get to the point of functional cure, as you coined the term, which I like, in terms of an increasing proportion of patients, we're going to need all these tools.
Thank you, Dr. Richardson. Dr. Shah?
Yeah, no, I agree. I think it's an exciting time. I think before these drugs came along, we had a challenging time because there's really no standard of care. And I think that is going to be even more compelling as we move forward, that there is no standard of care in terms of one regimen for all patients. So I think this really kind of highlights the art of medicine and art of myeloma management. And I think we have to embrace that as opposed to trying to get one standard of care for all patients. And I think if we can embrace that, then I think we can really leverage each and every one of these drugs maximally, including our antibodies, including panobinostat or proteasome inhibitors or IMiDs. So I think it's an exciting time.
The art of myeloma management. You heard it here first. So on behalf of our panel, we thank you for joining us today.